So, psychosomatic illnesses, what are they and what can be done about them?
It's a big topic. Psychosomatic basically is a type of illness that can be daunting to patients and healthcare professionals. Basically has to do with the mind-body connection and kind of tricks that our body and our minds can play on us. So most people, all we have in our world is our brains and the information that comes in from the outside to interpret the world around us. But that information is not always correct.
Yeah.
And it's really hard to separate what's true according to what's actually true versus the way that your brain and your perception of how you're interpreting the world, how those can be different things.
And so how are you supposed to know?
Yeah, it's a super hard thing to figure out. We try as doctors to figure out those things. We don't always do it. We don't have like 100% of the necessary tools to figure it out. We have a lot of tests that we can do. We don't have every test to figure out every problem in the world, so you just try to work with people. You just try to, if they have psychosomatic things going on, it's hard to bring that up with people because people really don't want to hear that.
You tell them it's all in your head.
They think that
it's tough.
You're telling them they're crazy.
Yeah. When
it's just that difference between how our minds can perceive the world versus what might actually be going on. And those are true perceptions. Like the perceptions are real.
Yes.
Like the things that happen, like people can have pain.
Yeah.
There's no explanation for. It might be a nerve that's misbehaving, but it might be some other type of stressor that's causing their brain to misinterpret reality.
Yeah.
And that's kind of where psychosomatic illness is. It's tricky.
Whether the illness itself is real, the misinterpretation, like mental illness is a real illness.
Yeah, and it's not necessarily mental illness either. It can be for other reasons.
When I almost feel like it's almost a definitions. like I want to start talking about Wittgenstein and postmodernism rather than, this seems like a modern problem of like, well, what does it mean even to be sick?
Yeah, it's very
is it mental illness or is it personality or is it,
Right. Yeah, it's very philosophical and nebulous.
Yeah.
And whenever we have these in the medical world, we know it's going to be tough to figure out what's going on.
Do you guys take philosophy classes and do you have to like...
Philosophy is not required.
Yeah.
No.
And I find that surprising.
Well, there has been a push for a long time in medical school applications to have well-rounded individuals. So actually, when I was in medical school, my class president was a philosophy major.
There you go. Yeah.
So they really want people more in the humanities, people who are able to relate to people. That's been going on, at least at UND, where I went to medical school, for a long time, where they're looking for well-rounded people.
So this is the show. This is the show where we explore the who, what, where, how, and why of the extraordinary people who define our north of normal metro. I'm Conrad Fargo, and this is the Fargo Five. Today we have Dr. Jessie Lindemann. I didn't ask you how to say. I just blew in here.
Oh,
nice
that's okay.
Lindemann?
Yeah. Lindemann.
Yep. A family medicine physician and founder. Founder or the founder?
The founder.
The founder of Willow Health. I know you from Jared.
Yeah.
Intrepid Tech,
yes.
Previous guest to the show. He said that you're awesome. We squeezed you in. And this is our first time meeting, which has been, I blow in on the phone. I'm a total mess. And then I'm like, hey, how about we try something new I've never done before? Which is the cold open.
Yeah. And you were like, psychosomatic. What do you know about that? And I'm
did great.
Oh my gosh.
You did great.
I had to whip that together in no time.
And we get into these conversations. And so that's usually where the show ends up. And you're much warmer by then, but you did great.
Sure.
You did great. And I could feel you warming up as you were getting into it. And I don't know, I think it's a better way. I think it has more hook in the beginning so that people
people into the show.
Because, people have a short attention span.
Yeah.
Like podcasts are a long form thing, and people are willing to do a long form thing, but you do got to hook them. You got to get them to commit.
Yeah, because it's easy to just move on to the next one if you're not interested.
So cold open for the commit. You are our first doctor, and we're going to be doing that from now on. Cold opens all the way down.
Awesome.
So why don't you tell us exactly who you are and what you do?
So, like you said, I'm a family medicine physician. I opened Willow Health about a year ago. It's my solo practice. I actually have been the only employee for my practice for the last year. And that works because I'm in a cost sharing arrangement with a colleague. So she employs the staff and I share the cost with her, and then we share the space and the staff.
This is very cool. Okay.
Yeah, it was cool. Now I'm ready to go off on my own. So that's kind of where I'm bringing in Jared. Is I'm moving to a new clinic and I'm bringing on more cybersecurity where I'm going. So, yeah.
Okay. Well, yeah. So, but you aren't. Have you ever been at like Sanford? When I think of like a doctor, like a medical doctor, I think of a big hospital and everybody, and I've never done anything outside of that.
Okay, yeah.
But you're not, or you haven't been, or
so I don't want to name names, but yes, I worked in corporate medicine in Fargo for 7 years.
Yeah,
yes. Yep.
Okay, and before Sanford around here was Merit Care, right? But we don't want to, and there's also Essentia in town. There's all kinds of different ones. We don't have to name names, but just for frame of reference.
Yeah.
But probably, what percentage, my experience in life is what it is, and it's limited. What percentage of doctors would you say are doing a private practice as opposed to corporate medicine, or however you'd want to refer to it? Like, I'm just trying to get an understanding of the landscape.
I would say a lot of people are looking, providers and doctors are looking for something different.
Yeah. Oh, yeah. Yeah.
There is a movement. I've seen more and more colleagues going into the independent world and leaving corporate medicine.
The problem, of course, is the insurance.
Oh, my gosh. There's so many layers to the problems. And I don't want to talk poorly about any systems particularly, but I think just everywhere in corporate medicine, there's problems that we can all see, right?
Yeah.
It's hard. It's hard to call your doctor. It's hard to get an appointment. It's hard to get your doctor to call you back. It's hard to get your prescription refills.
Yeah.
When you go to the doctor after you've waited for 6 months, they might cancel on you because that doctor left already. Or you get to see them once and then they leave. Or even if you do like them, you get 5 or 10 minutes with them because that doctor's on a hamster wheel. And just you have like quotas or just like certain amount of patients that you're supposed to see within a certain amount of time. And that's how those jobs are.
So I have training more in economics, and I think about incentives, and it is certainly the case that the current medical system, the incentives are upside down and backwards, right? I mean, when you were in corporate, what percentage of your time did you even spend with your patients versus filling out paperwork? Like,
oh yeah, the paperwork is insane.
Yeah.
Especially it gets more and more because of insurance companies, prior authorizations, patient messages, refill requests. I mean, there's just so much time that you spend even outside of the patient encounter doing everything that you have to do. And so even though you only get 5 or 10 minutes with each patient, you actually spend a lot more time on that patient because of all the extra work that you have to do in the background. And so, yeah, that is one of the things that's run by insurance, but yes, it's run by, like you said, financials, bottom line.
And so when you move into the private practice, like how does that change up those dynamics? Like, do you take insurance? Or
I take
is
insurance.
It,
yep.
okay.
Yep.
And
so it changes it in that I can make my schedule what I want it to be.
Yeah.
As long as I'm financially able to cover my costs.
Yeah.
I can see fewer patients in a day and make more time for each patient.
Yeah.
when people call my clinic, they're going to get the same 1, 2, or 3 people answering it every single time. They're not going to be fed into a phone system.
Yeah.
They're going to be people that get to know them.
Yeah.
And that message that they have for me is going to get relayed to me. I have a texting app that's a HIPAA protected texting app where patients can even text me.
Yeah.
And I can see, I'm at the pharmacy, my refill's not here. I can just try to fix a situation as quickly as I can.
And so what is your day-to-day, like I said before, I asked before, in corporate, very little of your time is spent actually seeing clients, and do you have a handle on how much time you actually spend FaceTime with clients? Because I don't know what it's like to be a doctor. So like what I'm interested in more maybe is like, what is it even like?
Right.
A lot of the doctors we get coming in here with solo practice are alternative medicine doctors. Those are the ones who are usually running around, doing solo practice and that kind of stuff.
Yeah.
Everybody else with a because you have just like a standard, what the kids call allopathic medical degree.
Allopathic
you're
MD.
just a regular old doctor.
Exactly.
And you don't see a lot of those running around as like a person, right? Like that's like I don't see it.
Yeah.
I'm into networking a lot.
You don't recognize them, but I know who they are when I see them around town because I know most of the doctors around here.
The other solopreneur,
solo
allopathics.
or corporate, I know because I worked for a large
There's only so
one.
many doctors in town, I suppose.
Only so many.
How many would you?
Oh gosh, I don't honestly know.
So like for
That's
a good frame of reference. Or, to help get some comparison.
Yeah.
I'm a realtor at Berkshire Hathaway Home Services Premier Property. I got to say the whole thing. And so I don't know. People don't know that there's like 1,000 of us, right? So when so-and-so is like, oh, I know such and such realtor. Do you know them? I'm like, no. Like seldom do I do a deal twice with another realtor. There's 1,000 of us, but doctors, maybe not such a large pool of talent to choose from.
Yeah, there might be 1,000, I guess.
Oh, yeah?
I'm
Okay.
Not really sure. I'm guessing there probably are.
And how many of them are solo practicers?
Oh, not nearly as many.
Yeah.
So most of the independent practitioners in town are part of the Heartland Healthcare Network, which is just a group that, we pay a membership fee to, and then they help us get, contracts with, 10 or 15 different insurance companies, and then they help, they promote us on their website. And if people are looking for an independent doctor, there's not just doctors, there's therapists, all kinds of different independent healthcare providers on there. So you can go to their website and just look for anybody who's in the Heartland Healthcare Network. So,
do you know off the top of your head, like how many or what insurance companies you take? Like, is it something that day to day you're just like, yep, I take this, I take that, I take that.
For the most part, yeah.
Yeah. So, can you name like big names? Like, do you
we take Medicare, original Medicare, and Minnesota and North Dakota Medicaid. We take Sanford Health Plan, not the employee plan. We'd like to, but They won't send their employees outside of the.
Yeah. Okay. But so I haven't had a job.
Blue Cross of North Dakota, Blue Cross of Minnesota.
I haven't had a job in like 14 years, so I'm on Obamacare.
Mm-hmm.
Like, do you take all of those ones? Is there something about them that is lesser or greater?
No,
or
we take those.
Okay. Yeah.
Yeah. Usually they're kind of a part of Medicaid. So it's kind of like a stratification of Medicaid depending on your income bracket, right? There's multiple levels of Obamacare and Medicaid.
I don't know. No, I mean, you know all about it, right?
Well, I don't know that much.
All I know is that I'm forced to go and buy something every year, and I'm as we were discussing before the show, I'm a hypochondriac, right? So I feel compelled to buy the very best insurance that I can possibly get my hands on because I'm mentally ill and I'm afraid that I'm going to get sick at any minute. And so, but why would somebody choose to stay in the corporate side where they get less customer
security
service?
There. Yeah, there's security. I mean, I haven't had financial security since I went independent.
Yeah.
So I need
for
more,
yourself. Yeah.
Yeah. I need to see more patients. My schedule is not busy right now, so I need to get.
Well, you got to
hustle. Another reason that I'm moving is that I'm hoping that I'll be in a much more visible location. It'll be right on Broadway, North Broadway, and so the sign will be right on Broadway. People see it there, and also hoping to bring back some of my previous patient population that hasn't found me yet. So yeah.
Okay, well, so let's talk about the journey through corporate and then into solo practicing as you've done it.
That was a bumpy ride.
Yeah, well, and I would like to know. So what I'd like to do, and we discussed podcasts before, right?
Yeah.
And you as many people do, you enjoy the murder mystery ones where they like tell a story of like, well, this happened, that happened.
Yeah.
I want to tell a story.
Yeah.
But not a murder mystery, more like an origin story,
hopefully
right?
It's not a murder mystery.
Yeah.
And I hope it has a better ending than that.
Where Lindemann?
Yes.
Dr.
Exactly.
Dr. Lindemann graduates from UND, you said,
yeah.
right? And I don't want to talk maybe all that origin story, but you graduate, you've got a doctorate degree. How old were you when you graduated with your doctorate?
I was the oldest in my graduating class.
Yeah.
I was 37.
Oh, wow.
Wait. Yeah, 30, almost 37. Yeah, 37.
All right, then we do have to go. That's
Sorry.
the show. No, we peel it all
I'm
back.
sorry about
so
that.
how is it? So they tell us it takes 8 years to become a doctor. So you started at 29. What were you doing before then, or are you even later?
I went to college. I got a chemistry degree.
Okay.
I didn't want to be a doctor. I worked as a chemist.
Did you get a doctorate and a
I
PhD?
have a master's degree in organic chemistry.
Mm-hmm.
Yeah, so I worked at Prax in Fargo, if you remember Prax back in the day. I did. Yeah, I developed bioanalytical assays for Prax.
Very cool.
And then I worked in a biotech company in Madison, Wisconsin, doing synthesizing DNA, basically.
Oh, my.
Yeah, so that was fun, too. And then I met my husband over in Wisconsin, and I applied to medical school while I was there.
So you're already out in the world doing corporate chemistry stuff.
Yeah.
And you're just like, I hate this. Or what? Like, what's...
I got sick.
Like, physically ill?
Yes.
Okay.
I got Hodgkin's lymphoma.
Oh, my.
So,
no.
Yes.
Okay. So you got cancer.
Yes.
You got cancer. And that's... You must still be struggling. That you don't ever, like,
that
fix
was
that.
22 years ago.
Okay.
So it is kind of like my lifelong passion now, though.
Yeah.
So initially it was this period of recovery, and I'm going to go to medical school because I'm going to make sure that people are treated the way that I was as a patient.
No. This is the show. So this is the show. Peeling back the onion. Okay.
Yeah.
So it's so fine. I should just change it to the Fargo onion or something. I don't know. That has other connotations. The onion, right? Okay. What's it like? Getting lymphoma. That's no, that's not leukemia. I'm sorry.
It's lymphoma.
Okay, yeah.
It's cancer of the lymph nodes.
Yeah.
Well, I mean, I think I was sick for a long time. So because I lost energy and motivation during graduate school, I'm pretty sure it's why I went with the intention of getting a PhD, and I left without it. I left with my master's because I was tired. I couldn't get into the lab.
But you weren't married, and so you didn't have kids.
Right.
Like, I'm tired all the time, but...
it was a different type of tired.
Yeah.
It was more of this just, like, bodily exhaustion.
Yeah.
That is hard to describe, unless you experience it. And then I developed some abdominal pain that was the thing that made me actually go and get diagnosed. Yeah. So I went to a lot of different places in Fargo that never found anything. I ended up going to Mayo Clinic, and I had good insurance at the time. So they ended up finding it there. They found it on a chest X-ray. So
you went to regular old doctors, and they didn't find your lymphoma. Mm-hmm. They didn't do a chest X-ray? You didn't ask them to do a chest X-ray?
I didn't have symptoms in my chest that I was aware of, until later. I was like, oh, yeah, I had this little cough lately that wasn't productive or anything. It was just like a little... kind of thing, but I was a smoker. So I just thought it was like a smoker's cough.
So people will say, "Oh, I'm such a hypochondriac. I have OCD." When I tell you that I have like real struggle with that kind of a thing, it's real for me.
Sure.
And so
Yeah.
when you talk about these symptoms, I begin to have them, which is a lot of fun. So this is like a fun little spiral for me. But no. But I would
Well, you
really
have the self-awareness though, where you're like watching yourself do this.
I have never met somebody more self-aware than myself. That's for sure. But what I would like to focus in even more is, I mean, did you begin to suspect? What was the hunt? Because you were, like you said, you were just tired all the time, and you go to the doctor.
I lost my appetite.
You weren't like, let's get a CBC. You weren't like,
oh yeah, I mean, all of that was done. The CBC was fine,
and everything came back normal.
I had an abdominal CT scan that they didn't think there was anything wrong with.
And you just kept digging.
Well, because I was giving up, and then my dad said, "This isn't right. You're not right. Something's wrong." Because I wasn't. I could barely go to work. I just laid on the couch when I got home, and I was in pain. And he was like, "We're just gonna keep looking." And we went. We got an appointment at Mayo Clinic, or he got one for me, or like there was a cancellation for the next day. So we drove down there, and it was a gastroenterologist because my symptoms were in my abdomen. The pain was. Then he was like, "We're going to figure this out." So he's the one that ended up ordered every test that hadn't been done, lung function tests and other lab work that hadn't been done, crazy off the wall stuff.
Yeah.
And then finally chest x-ray, it was like, oh yeah, there's like a huge mass in there.
Jeez.
So
has it so you think this started while you were still getting your master's?
Yeah, well, when I started seeing the oncologist, I asked him, how long has this been growing? Because it wasn't an aggressive tumor, and he said probably several years.
So it never went malignant, or how?
Oh, it was malignant the whole time. It just was very slow growing.
Well,
yeah.
What is it what's the bounds of malignancy? I thought malignant means that it's spreading around.
It did. So
Geez. Okay.
Yep, so it spread, in my chest. Lots of different lymph nodes in my chest.
It's lymph tissue in your chest. That's why we call it lymphoma. Okay.
Yep.
Okay.
And then it had crossed my diaphragm, which gives it a stage 3. When it crosses the diaphragm, that's, ramps up the spread, right? So it's spread across the diaphragm into my abdomen. And I think that's why I was having pain, is one of the nodes was large enough to where it was pressing on a nerve or something.
Now, cancer doesn't come and go. It's not something that gets better and worse, right? So it's one of the defining things is that it started bad and then just kept getting worse and worse and worse.
Yeah.
So that's maybe one of the ways. I'm sitting over here having a panic attack and asking, like, how would you even know? Because I'm sick all the time, and so I have to turn off. I don't have an alarm system anymore. I had to learn to turn it off. Right, and that's the opening question about psychosomatic,
Yes.
right? Because I've almost gone the complete other direction where I've disabled all alarm systems,
right?
Because my alarm system is broke, right?
Yeah.
And so I am very self-aware to know that I might be gaslighting myself into ignoring a real problem. And so how would one even be able to distinguish? Like, what are the concrete, external, measurable things that could be done if all your CBCs are coming back clean, your labs are clean, everything's clean, you see them by a doctor and they go, well, I can't figure it out. It must be in your head. You want to talk about psychosomatic?
Yeah.
They must have been telling you it was psychosomatic.
Yes, I had been. I'd had several doctors who told me it was psychosomatic.
Right?
Yeah.
And so, but if it is psychosomatic, and that's the issue with psychosomatic disorders, and that's the real heck of the absolute 11th level of hell problem with them.
Yeah.
Is that if it's psychosomatic, you need to quit it and push through. Like, that's the only way out is through. But if it's real, you need to give it all of your time and attention and stop everything.
Yeah, I mean, I guess in that way, I did feel super lucky, actually, when I got the diagnosis. It was like, oh, this is great. You
Yes.
know? Like,
Yes.
probably one of the few people who was,
Finally.
pretty okay with a cancer
Finally, I
diagnosis,
know what
'cause
it is.
It's a kind of cancer that's curable.
Yeah.
They considered one of the first curable cancers. Or the first curable cancer,
Lymphoma.
Hodgkin's lymphoma.
Okay.
Yes. So, so that was like, okay, like I might live because I had already resigned to not living. I was
Yeah.
already
Wow.
like, I don't think I'm going to live through this.
Spoiler
Yeah.
alert, you seem alive.
I'm alive.
Okay,
Yes.
great. So, okay.
Yeah, the treatments worked.
Yeah. So all of that, I mean, drama and intensity, and you being an academic type to begin with, you must have went to learning everything you could, right? I mean, or how did that, what was that process?
I
Or when did
tried.
it-
I mean, I was pretty tired, for a long time afterwards, but I did. It was like there was a moment that was an epiphany that I had while I was doing chemotherapy where I really felt terrible. You know, I wasn't one of these people who was tolerating chemo and doing fine and able to work. It was hard on my body, and I didn't want to do it anymore.
Yeah.
I wanted to just ask them if I could stop. It was 4 months and I had to do it for 6 months. So I said, I had this moment where I said, if I keep doing this and I make it through, this is what I'm going to do. I'm going to go back to medical school. I'm going to turn this into a positive thing, and I'm going to try to make it so that other people don't have the experience that I did.
I don't want to get you in trouble, but going through all that and struggling so much with the chemotherapy and the allopathic remedies, did the siren song of alternative medicine, like,
Never.
where did you, like,
No.
never, like you were already resigned against it, or what?
I mean, I grew up in a medical family too. Like,
Yeah.
my dad and my brother are both MDs.
Medical
also.
doctors.
Yes.
Oh,
Yeah.
okay. Yeah.
So
Well, and that's why Dad was such a great advocate for you.
Yeah,
Yeah.
he recognized that.
When and so we discussed, right in the beginning of the show, how trash the medical system is, which is why I believe the so-called naturopathic remedies exist. I think they cut a lot of corners to give people the real care that they need and make real benefits in average people's lives for an affordable and simple way. But I don't know that they have a great theory of action, right? Like
I don't know that I
the basis
have,
underneath them and behind them, and
Yeah.
and so
I don't want to. I don't want to.
Besmirch
I don't know that much
about it. Yeah.
naturopathic doctors,
Yeah.
and so I don't really have a lot to say. I know that I like to have good relationships
Yeah.
with them,
Yeah.
because I know that patients trust them,
Yeah.
and I want us all to communicate, and I
Yeah.
want to know. I just want to have things out in the open.
Well, I'm friends with a lot of chiropractors because I'm a realtor. And so for my sins, I got to do a lot of networking.
Yeah.
Right. And so, I see a lot of them out there, and I love them. And they're good. They're earnest people,
Yeah.
and they're providing a lot of benefits to a lot of
Yes.
people. And there's so much truth and power behind what they do. But I don't know that anybody has their hand on any of it, right? Like, and it's tough to
Yeah,
know
there's
anything,
not.
man.
Yeah.
And that's.
So it takes a village, I guess. We're all kind of trying to help people out in different ways.
Different parts of the elephant, right?
Yep.
But, obviously your whole family is into the medical field. You say, okay, fine. I tried to be a rebel in chemistry. And I mean, what was it? You're going to turn it into a positive? Or
Yeah.
was it any of like, I'm going to follow in the
Well, some
family?
of it too was like, why couldn't they see the cancer on that abdominal CT scan?
Yeah.
Because they went back and looked at it again.
Yeah.
And then they said, oh, yeah, that's what those are. So I didn't understand that.
How they could miss that,
Yeah,
right?
because that would have saved me a lot of trouble.
Yeah. Well, and because the sooner you start, the sooner you finish, right?
Yes,
like
yeah.
the more you have
Yeah,
to burn out with the
I was
chemotherapy.
lucky that it wasn't stage 4. It didn't get into my bone marrow because that's stage 4. So I was lucky in that sense too. But sure, it could have gone longer. It could have gotten into my bone marrow, and then the survival rates are much lower. So,
yeah. I mean, the survival rate for everything is 0, though, right? We all die eventually. Well, and I think that's part of the problem.
I think they really, think about a certain amount of time, 5, 10 years.
Yeah, how much time do we get? But I mean, I think that's part of the problem is we're trying to figure it out, pass on as much as we know, do as much as we can to help, and then we get snuffed out, and somebody else has got to start over, right? And we just keep trying to build on this.
Try to do what you can to make a build on this in your little world,
So, but you went out. You got the medical degree. You said, I'm going to try to turn this into a positive. You graduate at I want to say the young age of 30-something.
Yes.
30 what? What was it?
37.
37. Okay. For reference, I'm 39, so like 2 years ago. That is to be starting over. And you were married?
Yeah. Well, I got married during medical school.
Okay. Yeah.
Yeah. And I had a baby during
Oh, my goodness.
School.
Okay.
I didn't even know if I would be able to have a baby after chemo and all of that.
Yeah.
So, we have one child. She's 13 now. Well, that tells you how old I am. But
yeah. Oh, that's beautiful, though.
So
wonderful.
Got to experience that, too.
I'm so glad that you were. I've got 3 kids, and just it's nothing like procreation, right? Like it's kind of talking about the whole meaning of everything.
Right.
You know what I mean?
Certainly, it changes your perspective.
Yeah, absolutely. So you graduate UND and you say, I'm going to go get a job. What's it like graduating as a doctor? Do you have something as a medical doctor? Do you have something lined up, or are you like, all right, now I got to go hit the Indeed?
You got to do residency first, right?
Yeah.
So there's a whole match system. So you spend most of your 4th year of medical school interviewing at different residency programs, and then you get matched, basically.
So nobody really graduates unemployed in the medical field.
I mean, there are some people that don't match.
Wow.
And so then they have to scramble.
Yeah.
So they have to, I think it is actually called a scramble, where you kind of try to match, open slots with, people who haven't matched. And then there's still some people that end up without a program. Or they end up having to switch specialties to just continue their medical journey, and then have to switch back into their specialty that they want later.
Because it's really tough to jump out on your own year one.
You just can't. There's nothing to do.
Yeah.
Nobody employs you.
Okay.
Yeah.
Well, exactly. But, okay, so then you get employed by corporate. You have to be. Because what I want to, and we've only got 15 minutes left.
Yeah.
But what I would like to now detail is you spent how long in corporate?
7 years.
7 years?
That was after 3 years of residency, which I did in Wisconsin as well.
Yeah.
But 7 years in corporate medicine.
And that is, as we know, dysfunctional, right? I mean,
Yes.
what was it? I mean, what was it?
It was interesting. It felt like it changed even while I was there. When I started, we had some freedoms with our schedules, or if I wanted to go to my daughter's music show at school, I could leave for a half an hour, and then everything just kind of got more strict. And by the time, I was about to leave, you had to get, multiple levels of approvals before you could do anything like that. And it was just this more tightening of your sort of freedoms, which just make it hard to practice. It makes it hard to, what is the point of staying here when I can go out and get,
So, but what's that? You say when I can go out, but we said when you graduate, you can't just start out on your own, or could you have? Could you have done?
I could have, yes. After residency, I could have started my own clinic at that time.
But you need the residency. That's like a licensing requirement.
Well, so what I'm saying is after residency, you can start your own clinic if you want to.
Yeah. And so what's that like, starting your own clinic?
It's a process. I really didn't know exactly what I was getting into. There is a lot that goes into it.
Yeah. And what is and that's like...
So from forming the LLC to getting registered as a practice with Medicare, Medicaid, getting all of your insurance contracts in place.
Whose idea is it? Somebody approaches you, or you start searching your own?
You have to reach out to them. Yeah.
Yeah. And so you're starting from square one. You're working in corporate, and you say, like, what was your, like, there had to be a moment in time where the idea was conceived by you, right? Where you were like, you know what?
So
like,
I originally formed the LLC because I was going to do sort of a side gig doing survivorship visits, cancer survivorship visits, where I was going to do like a telemedicine thing where I meet with cancer survivors and talk to them about, any additional screenings that they should have because of their history and the treatments that they've had.
Yeah.
Like certain chemotherapies will cause damage to certain organs. So like, for example, certain chemos will cause heart damage. So you need to have your heart monitored more regularly than the average person. So, that's still what I want to do. I still want to provide that service for cancer survivors, but then actually there's a little piece missing where I went to a community health center in the meantime, and I got laid off from there because they were having financial problems. Yeah. And this little clinic nobody's heard of it. It's over in Moorhead, and there's reasons that they're struggling financially. But so I got laid off. So that's what made me have to kind of figure out what to do next.
It's such a heavily regulated industry, and it has so many, and that's why, I opened up and said, like, from an incentive standpoint, like the money isn't in serving clients. The money is in filling out the paperwork and billing the insurance companies, right? Like, I almost feel like either, it's one of those...
super complicated. Yeah, right? Yeah. So, you see a patient, and then you write your visit note, and then there's coding that's done, and you get paid. You get reimbursed from insurance companies based on, like, the level of visit or how complicated it was. Yeah. Basically, yeah.
Yeah, but why is it so hard for a person on their own? You
just have to have startup cash, like there's the clinic space, there's equipment that you need, there's staff that you have to be able to pay for. Yeah. There's a lot of costs. Yeah. There's the EMR. You have to have an electronic health record. Those are expensive. You have to have insurance, commercial and liability insurance. And
the insurance doesn't like insuring people out on their own. Like, it's probably far more affordable?
It's not too bad. The insurance so far hasn't been too bad. Okay. They're nice to you initially, and then they keep ramping it up as you go along.
Okay, I see. Okay. And so what's it like when you are out on your own? So how did you find the network even? Like, you just Google searching, or what was the process of getting...
Heartland Healthcare Network. Yeah. And I did a lot of networking in terms of just going out and talking to other independent doctors in town, some of the dermatology groups that have been started, the surgery center out in West Fargo. Yeah. Those docs out there, I went and talked to them. It's nice to have a referral network that's independent, and I use corporate facilities as well as the independent doctors, and we have conversations with patients about where they want to go. Instead of being shoveled through the same system, I get to give them options. So
what's it like, though, when you do need to send somebody, like, to an oncologist? Because you're not an oncologist, right? And you make the determination of, like, well, we need this scan or this whatever, and it's equipment that, frankly, you don't have on hand, right? Like that. And is that kind of the advantage of the corp, or how does it...
Yeah,
do you send them over?
Right, yeah. I just put in an order, either fax it, or I'm able to log into some of their EMRs and place orders, like, right within their systems. Some of the systems work nicely with me like that, where I can do that. So, it's really not that different than the way that I did it when I was employed by corporate medicine. You just put in the referral, and the referrals department calls patients, sets up the appointment,
So do you feel confident that, like, if you just had enough patience, the whole thing would pencil out?
Totally.
Like, it's not...
Yeah, we're going to be... And I'm pretty confident I'm going to be fine. But I do just need more more visits. I just need more visits to be able to cover my costs, because right now I'm barely covering my costs.
Well, when I see something that is standard, like the corporate model, I say to myself, okay, it's largely dysfunctional to the benefit of the doctors, but there's a reason. When I see things that exist, there's a reason, right? Like everything is kind of set against you. You do have to have so much up front, so much equipment on hand, so many things. The limiting factor in being out on your own really is just having enough loyal patients. That, to me, that doesn't seem right. You think you would see more people out there doing it, I guess, is what I'm saying. Like, why does everybody choose?
They are. There's a trend. It's moving towards independence.
Okay. And do you see a lot of people coming in without insurance at all, or everybody has insurance, or how is that? Because I know we were
if people want to
required.
pay cash, they can.
Yeah.
But it's not a free clinic. I've had that question. We don't do sliding scale. We just charge a fee. And then I have patients with insurance who still want to pay cash because it's going to be cheaper for them to pay cash than to have it run through insurance, and they know that.
How does that work out? So, like, their insurance copay is because they only have disaster insurance, or what's the?
Because they have large deductibles.
Yeah.
And then the amount that you charge insurance is more than I charge for cash.
Yeah.
Because I know the insurance isn't going to give me what I charge them.
I see.
They give me whatever they feel like.
Yeah.
They tell me what they're going to pay me. Even though I charge a certain amount, they don't pay me that.
And so how many more patients do you need to make the whole thing pencil out full time in a way where it's
twice as many?
Okay. Well, so how many do you have right now then? Like
about 240.
Oh my. Okay. So you've got 240 people who call you doc and right underneath you. Wow.
When I was in corporate medicine, I had 2,000.
Oh my goodness. Is that
That's normal.
Wow. Okay. Yeah. So another thing that I do besides real estate is small business consulting. And I work with people who are working, 2,000 clients, because it's a long-term relationship. You don't get a doctor one and done. That's a long-term. Yeah. So I'm just imagining as like other business models that I know and I'm familiar with, the idea of having any kind of a long-term relationship. Is that a standard number for a family medicine doctor to have? Mm-hmm. So I'm going in for my physical next month, and my doctor, she has, because she knows me and remembers me, knows details about my life.
Yeah.
It's hard for me to imagine that she knows, remembers, and has the details of another 2,000 people.
She reviews your chart beforehand, probably. She might make little notes to herself that make her seem like she remembers you. That's a trick that I have, where I write little notes to myself. Like, this person said they were going to Europe next month, so ask them about Europe next time. I mean, just little tricks where I try to have little ways of making people think that I remember, even though it might be kind of hard sometimes. But I do. There's definitely patients that you remember. You do remember most of them. If it's not all of the medical history, you recognize faces. You recognize how people acted the last time you met with them, what they were like. I'm a big proponent of having a primary care doctor, and that's one of the things that I didn't have when I was sick, because you need somebody to know what you look like when you're well and how you act when you're well. Because if they don't, then they don't know when you're sick.
Yeah. Wow. I'm just, my mind is blown to think that that's the scale that they're all operating at. So, but if there's 250,000 people in Fargo and there's, you said, about 1,000 doctors.
I don't know that number.
Yeah.
That was a shot. They're probably more than that.
Yeah. Well, but if there's 250,000 people, and how many doctors, then that would be an average of 250 per doctor. If
I'm not talking primary care doctors.
Okay.
Most doctors aren't primary care, right?
Oh, I see.
So.
Okay.
So you have to, I mean, most doctors are specialists,
Yeah.
are different specialty than primary care.
If you could make one change to the entire industry, like, I mean, because it must not be what you were expecting, right? And that's why you pulled out of corporate.
Right, you go into it bright-eyed and bushy-tailed and just thinking, you know, everything's going to be all roses and nice, and then it takes a while to kind of learn some of the things that you don't like about it as much. But insurance companies, regulation.
Well, and but if you're a cash, I mean, can somebody just show up and be like, here's $100, look at me? Like, is that how it works, or how do you?
Yeah. Well, we usually charge $200 for the initial visit, and $150 for additional visits.
Okay.
Yeah. Mm-hmm.
But yeah, because otherwise the administration is taking up probably a huge amount of your time.
Well, I mean, you still have administration with the cash pay patients, but yeah, I mean, there are, there's other models of healthcare too that don't use insurance.
Yeah,
there are cash pay methods. But it's just so hard, especially in this town where so many people have insurance and want to use their insurance. And you still have to have insurance, even if you are cash pay, to cover hospital or other, emergencies, because I don't do that. Mm-hmm. I'm outpatient. I do clinic.
Yeah.
I don't go to the hospital. I don't have a hospital. I don't do, some of the other things that people need. So people still need to have insurance.
Definitely a tough nut to crack. Well, that was the show. I mean, the medical system, I think, is more complicated than we can crack.
We aren't going to fix it
in
today.
An hour.
I don't think I'm ever going to fix it. I can just do my little part.
I was impressed. So I ask everybody for music to play at the end. And often I get stuff. I am a music snob. There's a lot of music. I love KRFF 95.9.
Yeah.
Because they play a lot of really good music.
Really good music.
Like really good music.
Mm-hmm.
Like really, really good music.
Yeah.
I am a snob. But I was not expecting
the response.
Fugazi.
Yeah.
I mean, The Waiting Room.
Yeah.
That's where did that come from?
I've been on a Fugazi kick again recently. I saw them 30 years ago when I was in college. And I just think The Waiting Room, the song about the waiting room.
Oh, hey, because medical.
Because medical, sitting in the waiting room.
Uh-huh, okay.
He seems like he has a lot of angst about that waiting room.
They're great music. Is Fugazi a well-known band? I always kind of thought, I don't know much about them. Waiting Room is specifically one of the songs that I had picked up in my early 20s.
Sure.
Like somebody had made me a mixed CD, and it was on that mixed CD.
Yeah.
I've never heard anything about Fugazi outside of that. Do you know much about?
I mean, I used to listen to more of their albums. I mean, I guess I haven't recently, but I'm starting to think maybe I should.
Are they?
Again.
I mean, they're not are they a well-known mainstream kind of they're not like your Green Days or your Weezers or your, are they?
I don't think so. No, they're more.
Feels niche.
More along the lines of like Helmet or, I don't know, some of the other stuff that I listened to in high school and college.
Yeah. All right. Yeah. Well, we are going to give that a listen. I'm going to rock out here when we go. But one last time, why don't you let everybody know who you are, how they can get a hold of you. Plug yourself.
Yeah. So come and see me. I'm Dr. Jessie Lindemann, family medicine physician at Willow Health. You can go to my website online. It's willowhealthllc.com, or give us a call to schedule an appointment, 701-658-5577. Thanks for having me on, Conrad.
Thanks for coming on. Of course, I'm Conrad Fargo. You can find me anywhere. You can type in Conrad and Fargo. If you put the two words together, I'm going to come in. So thank you so much, Dr. Lindemann, for coming in. Thank you, everybody, for listening, and we will see you all next week. Goodbye.